Fear of cancer relapse is something that patients and their families live with every day, I think. It is the fear that their disease or their illness will come back, that their cancer will come back in some form, that they will never, I think some people feel that they will never truly be cured. And particularly within haematology, most people, they will always use the fear, they'll always use the word remission. That I'm still in remission. They very rarely say they're cured or that they're better. They often say, they use the, much like we as healthcare professionals do, use the word remission. They do the same because they always feel that it's going to come back. The fear of cancer relapse on patients' lives, I think, can be quite significant. I think that particularly when it comes to significant life events and different things, that they get worried that this may recur. I think that any symptom that they have for anything at the back of their mind, it's always that this might be thing. So for instance, this time of, as in winter, they get the flu. An awful lot of them, if they have had night sweats and things like that, they think that this is their disease as well. So it's very difficult. They can link any symptoms, even if it's something quite minor and quite trivial, to could this be my cancer coming back? Fear of cancer relapse, I think, is very common. And I think it is something that is underreported and understated by patients and their families. I think everybody, it may not be something they think of every day, but particularly when it comes to significant life events or significant times of year, I think everybody gets a little worried. And I think it's something that I think that patients really don't express to the degree. I think it's much more common than we think it is. I think if you asked healthcare professionals or nurses, like in my hospital in their everyday practice, I don't think that they would report it as being as common as it actually is, because I don't think patients say it to them because they don't want to look silly, or they don't want to look like they're paranoid, or they don't want to think that we're going to refer them to a psychologist or a psychiatrist because they're expressing these fears. By accepting that it is good to talk about, that it's not something that should be hidden away and not discussed, and being open when they need to discuss it, but also when others need to discuss it with them. I also think that they need to, for want of a better phrase, force their allied healthcare professionals, be they clinical nurse specialists or their doctor or something, address it with them also, not let it be swept away and say, look, that's not something to worry about, everything's fine at the moment. Caregivers can help support patients with their fears about cancer relapse by allowing them express it and talk about it. It's very difficult for them also because caregivers include your loved ones who also are very scared and live with this fear as well. And by being able to, again, talk, communicate and discuss and not try and pretend that it's not there. As they say, the saying, the elephant in the room, let's all ignore it. It's really important that we encourage communication, that we give people time and space to express it, and that we don't ignore it. I think fear of cancer relapse has a significant effect on patients when they're planning for their future. I think an awful lot of patients can change what they're thinking about doing. But I've also seen it affect patients positively in that they have changed what they're doing because they're not happy with what they're doing, and they've made life decisions based on this, that they may as well do what they've always wanted to do. So it can also be because this may come back, or I might relapse, particularly if they have a lymphoma or something that's on a watch and wait plan or something. I think that it's also had very positive effects because they do things that they stop putting things, as we say in Ireland, on the long finger. They stop putting them off and they say, look, I'm going to try and do this now.